Good afternoon. Good afternoon. Happy Saturday, and thank you to everyone for tuning in again today. As per usual, I will continue to have daily press conferences at 1 o'clock every day. I'd ask you all to tune in. This continues to be the best place for you to receive accurate, fact-based information about the coronavirus in the state of Rhode Island. And I have found throughout fighting this crisis at every step of the way, the best way to combat the panic, the anxiety, and the frenzy is with facts. So tune in here. I hope that it gives you a bit of relief and an opportunity to take a breath by getting the information from the folks who are on the front lines for Rhode Island fighting the coronavirus. Unfortunately, I need to begin today's press conference on a sober note by reporting our first 2 deaths here in the state of Rhode Island on account of coronavirus. Obviously, the potential for the loss of life has loomed over us for weeks from the very beginning. These are the first 2 deaths and will certainly not be the last 2. We take all of them seriously. Our hearts and thoughts and prayers go out to the families, and know that we're with you, and all of the entire system and all healthcare providers are doing everything that we can in order to keep Rhode Islanders safe. I will say that this is, for me and for all of us, a reminder of the stakes that we face. I have been saying for weeks that deaths are inevitable. Today are the first 2. There will be more to come. Our hospitals are, today we're up to 29 hospitalizations. And in the weeks to come, we are going to be climbing up the curve. At exactly what rate, we do not yet know. But I don't want folks to be surprised when we start to see that happening. This is exactly what we've been predicting and planning for and working for weeks. Today I'm announcing we have 36 new cases in the state of Rhode Island for a total of 239 cases and 29 people in the hospital. We have been at this as a community for about a month. For about a month, I have been asking you to radically change your lives. And I know everyone's getting restless. We're all tired of being cooped up. And as the days drag on, it's getting more and more difficult. My approach has been to attack this virus aggressively, trying to stay a step ahead of it, but also in a targeted and thoughtful way. That has been the approach that will continue to be my approach, to take a smart, targeted approach based on facts, based on data, and based on science. To everyone who is heeding our directions, I'd like to say thank you. I know how hard it is. It's hard on all of us. It's difficult not to go to church. It's difficult not to visit your loved ones in a hospital or assisted living or in a nursing home. It's difficult to educate your children at home. It's extremely difficult to shut your business down and go without a paycheck. And to all of you who are heeding our directions, I want to say thank you. I want you to know you're doing the right thing, you're protecting yourselves, and you are quite literally saving lives. To the many of you who are not following our directions, I need you to do better. We need you to do better. I get data every day. The state police, town managers, mayors, public safety, police are out there every day filtering back information to me around how well Rhode Islanders are doing complying with the new regulations related to social distancing. And right now, our best estimate, albeit imperfect, is that we have maybe 50% compliance. Yesterday, if you had gone to the seawall at Narragansett Beach, you would have seen crowds of people crowded together in total violation of the social distancing guidelines that I've provided. If you drive around to big box retailers, you will see crowds of people too close together in line, too many people there crowded together in grocery stores, in big box retailers, in small retailers, on main streets. If you had been in parks and in beaches all over the state, you would have seen far more than 10 people congregating together in close proximity. If you had driven around last night, you would have seen far too many house parties of more than 10 people. I said it last week, I'm going to say it again. Knock it off. You are risking the lives of everyone in this state. Today I've reported 2 deaths, and in the days and weeks to come, there will be many more. We know we're on the way up the curve. We're working every day to refine our model to figure out exactly where we are on that curve, exactly how many additional hospital beds and ventilators we're going to have to procure in order to keep Rhode Islanders alive. We don't exactly know now. We don't know because it depends on you, the people of Rhode Island, and your willingness and ability to cooperate with these directions. Right now, we are not ready for a surge. I wish we were. It's not for lack of effort, but it's proving to be very difficult to compete with every other state and 129 countries around the world for the hospital beds and ventilators and PPE that we need to ready our system for a surge. Were it to happen in the next week or 2, we would not be ready. That means I need every single Rhode Islander cooperating with the orders that I am giving to keep us safe and to keep us healthy. And to those of you who are doing it, I know it ain't easy, and I'm grateful. And to the other half of you who still aren't complying, it's time to get serious, it's time to get real, because this is going to get very real very fast for all of us. And if you do comply, if you do what we're asking, we're going to stay right where we are, a step ahead of the virus. And one step closer to me being able to reopen this economy, which is the place that I want to get us as fast as safely possible. Because we're seeing such noncompliance with the orders that we've been issuing, I have just signed an executive order to further clamp down on some of these restrictions, and I am issuing a stay-at-home order for all people in Rhode Island. The order will be in place from right now until April 13th. What does it mean? It basically means if you're not getting food, getting medicine, getting gas, going to work, you need to be staying home. It's pretty simple. You can go for a walk, you can go to the park, you can go outside. If you do it with a few people and there's ample social distance between you and the folks that you're with. If you are sick at all in any way, if you have the sniffles, you have to stay at home, period. We don't have ubiquitous testing yet in the state of Rhode Island. It is my goal and intention to be testing 1,000 people a day by sometime next week, and we are on path to hit that goal. We are not there yet. That means we don't actually know precisely how many people are in the community that have coronavirus. We do know we're in a phase of rapid spread, and we have 29 people in the hospital. What that means is we're very focused on symptoms. We're at a place where we're very focused on hospitalizations and symptoms. We're quarantining and focusing based on symptoms. When we get to a place where we have more testing, we'll be more accurate. That means right now, if you have any symptoms of any kind, you are ordered to stay at home. And if you need a hand getting groceries or getting out, let us know, and we will help you do that. Or call your town manager or call the mayor. Go on the Department of Health website. We're ramping up those services by the hour to be able to help you meet your needs. In addition to the stay-at-home order, I'm also issuing the following orders effective immediately. All gatherings of more than 5 people are banned. This means everywhere. This means outside as well as inside. This means around your kitchen table, as well as around your conference table at work, as well as any place you can think of. If you're in close proximity to more than 4 other people at any one time, you're doing something wrong. I realize many of you still have to go to work. We are still having to go to work. To our healthcare providers, thank you. You are truly on the front lines, and I appreciate it. For the rest of us, you should be working from home. If you have to go into the office, you should do it. You should be there as limited time as possible. Keep at least 6 feet between you and other people, and at all times avoid gatherings of more than 5 people. Another note on this. Try to limit your interaction to the same 5 people. It's not that you should be with a different 5 people every day. We're doing our best to contain this as much as possible while we ready our system, our healthcare system, for the inevitable surge which will come. So if you have to be with people, make sure it's the same people each day, not a different 5 people every day, so that you're not spreading it to, not multiplying your number of contacts. This is about limiting the number of human contacts that each one of us has every day over the next few weeks. Domestic travel. Starting immediately, any person coming to Rhode Island by any mode of transportation after visiting any other state in the country for any non-work related purpose is directed to self-quarantine for 14 days. This restriction will not apply to public health, public safety, or healthcare workers. Yesterday, I announced fairly extreme guidance in an executive order as it related to folks coming from New York. I want to thank you all. I want to thank the state police and the National Guard for enforcing that. It's a necessary step. To that end, I've been hearing from many folks, particularly in coastal towns, about an influx of out-of-towners into our rental properties. So I'm announcing further action. I'm directing realtors and hotel operators to include in their rental and purchase agreements new requirements that any out-of-state renters must quarantine for 14 days in accordance with the guidance that I'm delivering. I want to take a second to thank the realtors and the Realtors Association and also Airbnb. You guys have been great. We've worked with them through the night to come up with this. I think it's a great solution. It's a way to allow people to continue to rent their properties, but to do it safely and to help us impose the quarantine. So thank you. I'd like to make a special note to commuters. I know we have a lot of commuters in Rhode Island who work in Massachusetts. As I've said many, many times, if you're able to work from home, you must work from home. I know that doesn't apply to everybody, but it does apply to many people. So if you can work from home, you must work from home. If you live in Rhode Island and work in Massachusetts at a job where you can't work from home, then you can go to work. You have to go to work. But when you come home to Rhode Island, you're self-quarantined. If you're a doctor, a nurse, a social worker, a therapist, public safety, have to go to work, I understand that. Go to Massachusetts, come home, and self-quarantine in your house. This is consistent with the direction from Governor Baker a couple of days ago, asking all people who travel to Massachusetts to self-quarantine. The next announcement is one that I have been trying to avoid, but in light of all the facts and circumstances, I feel it is necessary. Starting Monday, I am ordering all non-critical retail businesses to close their businesses until April 13th. There'll be a complete listing later today on the website of the Department of Business Regulations as to what defines a non-essential retailer. This is a step that I take reluctantly, after great consideration, and it's a tough one. Because I'm trying to maintain a semblance of an economy for as long as possible while we get through this. Having said that, we're receiving too many reports of people crowded into gift shops, retail shops, shops on Main Street, malls, outdoor malls. So for now, as of Monday, I'm ordering all non-essential retail closed until April 13th. And I'm asking everyone in Rhode Island, if you can, if you have the money to keep shopping, please keep shopping local, and just do it online. Go online, buy something today from a local retailer, help them out if you can. For the small retailers who don't have a website, who don't know how to take orders online, please reach out to us and let us help. You can call 521-HELP. We have secured a lot of resources from local tech companies, from Microsoft, and we'll help you get a website up and running. We'll help you get your e-commerce website up and running. We'll help you figure out different technology so you can adopt your small business. And again, due to the stimulus package, you're all now eligible for unemployment insurance. Previously, you weren't, but now that Congress has passed the stimulus package, independent contractors, small business owners are all eligible for unemployment insurance. And it is my sincere hope and desire to keep this limited until April 13th. And as I said at the beginning, my ability to do that will depend on everyone's willingness to follow these directions. I want to make another note. That order is limited to non-essential retail. It is consistent with my overall approach. Maintain a semblance of an economy, be smart, and be targeted. You'll notice I haven't said anything about manufacturing or other industries. That's because I want you to keep running as long as you can, as long as you do it safely. I want as many people working as possible, as long as you can do it safely. And when we do get to the business of reopening our economy, which is something I think about every minute of every day, because I know this is very, very difficult, it's going to be incrementally according to new rules that are designed to keep everyone safe. As we've gone out and about, and I am checking in on this every day, and we're doing spot checks on manufacturers, spot checks on child care centers, spot checks on retailers, spot checks on lawyers and doctors and accountants, we're looking for compliance. And if you're in compliance with the social distancing requirements, we're going to let you stay open. But if we start to see lots of folks congregating, sick people at work who shouldn't be there, then I will have no other choice but to further clamp down on this economy, which is not something I want to do. We're getting a lot of questions about parks and beaches. At this point, I am not closing the parks and beaches. We are ramping up our enforcement. DEM will have additional folks out there today monitoring the beaches, monitoring the parks. State police is out every day. Local police are out every day, first responders. So if in a few days it looks like we still have large congregations at parks and beaches, then I'll have to close them. But right now, it's still an outlet for people to get outside, to have some exercise, to be with their family. So I'm going to keep them open, but I am imploring you, please, that if you're out, which is a great thing, because you need exercise and fresh air, and it's good for your mental health, please do it in small groups and with the same group of people who you're used to being with. Yesterday, a reporter asked me if I'm worried about the optics of what I'm doing. Today, it's Saturday. We've been fighting this for a month. I have ordered the state police to monitor our border and stop cars coming in with New York State license plates, order them into quarantine, and collect their contact information. I've deployed the National Guard to TF Green, every bus stop, the bus terminal, every train station, taking people's contact information and ordering them into quarantine. You drive around, the economy is essentially shut down. And the answer is, of course, I'm worried about that. But I am more worried about and focused on outcomes than I am on optics. That's what this is about, outcomes, not optics. Right now, we are very, very fortunate to only have 29 people in the hospital. We've been at it for a month. We are not New York. We are not New Orleans. We are not Chicago. We could get there, but we are not there. Because we've been smart, we've been aggressive, and you guys have been terrific in everyone pitching in to make this happen. And after asking you to do hard things for a month, I'm back here today asking you to do even more. It's necessary. When you ask me if I'm worried about the optics of the National Guard knocking on doors today in Westerly and in Newport to figure out who's from New York and taking down their number and enforcing a quarantine, I don't like those optics. I'm more worried about the outcome of our hospitals being overrun, running out of beds, running out of ventilators, running out of PPE before we're ready for a surge. I have no good options in front of me. I'm out of good options. I'm out of easy decisions. I choose between bad option A and bad option B. So here's what I am doing. Making every decision based on facts, evidence, and data, listening to experts, being flexible and changing, operating incrementally. I didn't shut everything down all at once. And listening to you, hearing from the people of Rhode Island. It is my goal and intention to keep our economy on pause while we ready the system, and then over time to have a more pinpointed approach to how we enforce social distancing. Unfortunately, right now, our testing is such that we're not there yet, so I'm having to take a more blunt approach, shutting down all non-essential retail, shutting down whole parts of our economy. Sometime, I hope soon, weeks, not months, we'll get to the business of reopening our economy, relaxing some of these conditions, and having them be much more pinpointed. That's the goal, that's the plan, that's where we're going. We've made a huge amount of progress in the past week to get our system there. Right now, that's not an option. So to those of you who are saying it's too heavy-handed and the optics aren't good, I hear you. It's the best option we have right now to keep Rhode Islanders safe and healthy and alive. And frankly, it's the best option and decision in order to get us back on track and open this economy more quickly. So with that, I'm going to turn it over, as I always do, to Dr. Nicole Alexander-Scott, and then I'm happy to answer any questions.
Good afternoon. Thank you, Governor. Echoing the Governor's remarks, on behalf of our entire team at the Rhode Island Department of Health and across state government, I would like to offer our sincerest sympathies to the families, friends, and loved ones of the Rhode Islanders, the first Rhode Islanders who have died from COVID-related illness last night and today. As we've been saying for many weeks now, coronavirus is a serious infectious disease, and we must brace ourselves for the reality that there will be more deaths. There is work that everyone can do to address this. The Governor has shared very strong guidance about the need, the absolute imperative for people to respect social and physical distancing rules, not to get together and socialize, and to stay in quarantine if you're supposed to be in quarantine. What I will relay is some clarification on what it means to be in quarantine. If you are ordered to quarantine, you've returned from a neighboring state and need to be in quarantine for 14 days, that means that you are ordered to stay inside. If you need to get food or pick up medicine, you need to call someone who can do that for you. Or you need to use delivery services. Thanks to the governor's leadership, we have services and will continue to provide services to support people that need to do this. We know it's not easy, but effective quarantining means staying inside and letting someone else do those essential services for you. We will continue to provide that clarity so people know exactly what we are referring to with quarantining. Unfortunately, we've seen too many instances where Rhode Islanders are not following the vital mandates that we have been saying for a month. And so, as noted, the governor has had to issue these stricter mandates that are critical. We need 100% of the Rhode Island population to follow these directives. This is a critical part in helping to determine how high that curve is that we will go with hospitalized cases. We need to make sure that our healthcare system can withstand it. And it happens by people following these recommendations 100% of the time, 100% of the Rhode Island population. Not 50%, we need 100% of everyone doing that. In terms of data, as the governor said, we have 36 new cases. This brings our total case count to 239. 29 people are in the hospital. That's compared to 28 yesterday. People, please note that we're working to continue to have current data available to you every day, particularly knowing how quickly it is evolving with the number of cases increasing substantially. I also want to make another note on data. We have been reporting quarantine numbers every day. We know that these numbers can change because big groups can go on and off quarantine, as we discussed yesterday. As of today, 2,500 people are currently instructed to self-quarantine in Rhode Island. However, that number does not include the travelers and people from New York and, as of today, from the other states who are now instructed to quarantine. We want to make sure that everyone has clear understanding of what we mean when we're saying quarantine. And as I mentioned, it is staying inside, staying home, having someone else care for those essential needs that are needed. Our next big area of focus is going to be stepping up our efforts to protect the residents, patients, and staffs of nursing homes. This is an extremely serious health situation we are dealing with in Rhode Island right now. And this is a time when we need everyone to be acting responsibly and thinking about the welfare of the entire state. That goes for all of us in all settings, nursing homes, congregate settings, and in our own individual homes as well. For every Rhode Islander, if you develop symptoms of COVID-19, even if you have not been tested, you need to stay at home and isolate. Even if you have mild symptoms that seem like a cold, consider that COVID-19, self-isolate right now, and remain at home until your symptoms have been gone for at least 3 days. A key component is being aware of who you have been in contact with, direct contact with, and making sure that those persons are informed as well to self-quarantine. That's going to be a critical approach as we go forward that we at the Rhode Island Department of Health and, of course, state government are looking to build capacity to further enforce. If you think you need medical care, call your doctor. Do not just show up. If you have symptoms of COVID-19, everyone you live with and people you have been in close contact with while you were sick should again quarantine for 14 days. These are all important directives that we will continue to relay. We want to be able to say that we are able to change the height of the curve that we're talking about. The strict guidance that the governor gave today is what's needed to help us get there so that 100% of Rhode Islanders are following and everyone is doing their part to help us get through this together. With that, I'm going to stop and give back to the governor to answer questions.
Good afternoon, Governor.
Good afternoon.
First question is, how did the first day of door-to-door notifications to out-of-staters in our coastal communities go?
So today is the first day. We've only been doing it for a few hours, but by all accounts, it's been going very well. I think having a physical presence in these communities is very important. It shows how serious this is. Yesterday, I had a call with the town managers, mayors, and chiefs of police in all of the coastal towns. They're terrific. They're collaborating with us. I'd like to say thank you. I also want to remind everyone at this point, I've called up 1,000 guardsmen and women, and they're fantastic. They're working around the clock. And so thank you to General Callahan, and thank you to everyone in the Guard who's stepping up.
This next question is for Dr. Alexander Scott. ProPublica reports that other states have plans to triage life-saving medical care, if necessary, so as to disfavor patients with cognitive disabilities such as Down syndrome or Alzheimer's disease. What is the policy in Rhode Island? Will hospitals and doctors have discretion to use such criteria?
Our policy is to do what the governor described earlier. We want to make sure that the community mitigation strategies we are saying are followed so that our healthcare system has the ability to respond to those in need. We do not have a plan right now to discriminate against or disfavor any patients from any particular standpoint. We want to make sure that our healthcare system has the capacity they need to care for those who have the most serious illness. The key to us getting there is all of the steps that we are talking about now. Every member of the community, 100% of Rhode Island's population, needs to be able to follow the recommendations that are given. We need the community, parties, the access to stores where there are crowds. We need those activities to stop. That has a direct connection to our healthcare system's ability to be able to care for all of the patients that we want them to care for.
Governor, the next question is, do you have any immediate plans to hire more bilingual customer service reps or move state employees around to increase capacity at DLT?
We do. Every day we are striving to get a little bit better at providing information to all Rhode Islanders. Just so everyone's aware, these press conferences are all translated into Spanish. Every day on social media, on Facebook, we put out all of the key announcements in Spanish. I have my Spanish-speaking staff every day on Spanish-speaking radio. So if I'm offering that so folks know exactly where they can go. And of course, the information on the COVID website is in Spanish. Having said that, what I would say is DLT, Department of Labor and Training, is stretched to the limits, literally like never before. The number of claims we are receiving on a daily basis today exceeds what we received on a weekly basis during the peak of the 2009 recession. The very best advice I can give you is to please not call the Department of Labor and Training. Please operate exclusively through the website. Every time that someone calls and checks in on the status of their check, that just diverts that person's attention at DLT to answering the call instead of processing the check. So we are, throughout state government, we are looking to deploy resources to have more Spanish speakers. Having said that, please do not go into the office at DLT. Try hard to resist the urge to call. It's probably going to take us 10 days to get you your check. We'll do everything we can to get it to you more quickly. and all applications for TDI or UI should be filed on the website. If you don't have a computer, and if you're not able to do that, then of course pick up the phone and call to file your claim.
What does the stay-at-home order mean for restaurants offering delivery and takeout? Can Rhode Islanders still go and pick up their food?
We want the stay-at-home order to really reflect the goal overall that people stay inside, except for those essential needs. We want to really advance food delivery service options so that if you can call and have it delivered, then you can do that. If people absolutely need to go pick up their food, they can do that, avoiding crowds and any large gatherings of people to do so.
All right, the next question is about testing. Do you still plan on having drive-up testing sites as originally announced? Without testing, we have no way of knowing what the real numbers are, and our testing numbers are so low. What is the reason we are so far behind?
We do have the drive-up testing sites and can build that capacity out as quickly as we need to. Similar to what the governor has shared, the challenge has been making sure that we have the supply chain in place for our laboratory needs to be able to expand the testing the way we want to. We are still taking it in a stepwise pattern. We are working directly towards the governor's goal of getting us to 1,000 tests, but the challenge that we have faced, as well as others across the country, has been having the laboratory supplies needed to exponentially expand it the way we want to, and we're doing important work to address that so that our process can be sustained for the long term.
I'd like to address the testing question to give people a sense of where we are and where we're going. I don't think we are very behind, and certainly if you look at other states, we are not very behind. We are not where we need to be or want to be. The goal that I've set of 1,000 tests per day, which I hope to be able to achieve by next Thursday, would put us in line with the level of testing that you see in countries such as South Korea when they really started to get a handle on the crisis. The reason we can't get there sooner is because we are in a ferocious fight with every other state and many other countries for the medical supplies that enable the testing. I have tried many analogies to explain why this is so difficult. There's no one ingredient, there's no one supply to make this testing work. You need all at the same time the requisite number of swabs, testing kits, vials to transport the test, the actual machinery, sometimes more than one piece of machinery, the reagent, which is specific to each machine, and every one of those supplies is in short supply all around the globe. So the other day I used the example of making a cake or your favorite recipe. If you're baking a cake, you might have the eggs you need, but if you can't get the butter you need, you cannot make the cake. It's a very simple analogy, but that's what we're dealing with. So every day is a fight in the global market to get the supplies we need. Every day we're making progress, and today I still feel confident that by late next week we'll be at 1,000 a day. It's going to be incredibly important at that time that we triage who gets the test first and how rapidly the test results are delivered. So we are in the process now of putting together a statewide testing system. High-risk people will get their test in one place. Same thing with frontline healthcare workers, same thing with folks who are very sick. They're going to get their test back much more rapidly. And then everybody else, we're trying to set up a system so you have access to the test at no charge to you. But some folks are still going to be waiting a day or 2 or 3 to get the results because we're going to have to rely on labs that are out of state. Early next week, I will have an announcement explaining that in great detail, but I think, my mantra through all of this has been to be absolutely transparent with the people of Rhode Island, and that's as honest as I can be about where we are now and where I want to go. The metric we have our eye on right now, every minute of every day, is the number of people in the hospital. So the person who asked the question is exactly right. We don't know exactly how many people have it. We're telling you today 239 have tested positive. There are absolutely many more people in Rhode Island who are COVID positive that we haven't had a chance to test or get the numbers back yet, which is why we are so serious about ordering you into quarantine if you have symptoms. So the name of the game now is, if you're sick in any way, don't leave your house. Unless, of course, you're very sick, call your doctor, go to the ER, and do what your professional healthcare provider says. And we're watching hospitalizations, because that's a fact, that's knowable. And we have our eye on that to try to tell us where we are in the curve and when we might be seeing a surge. There's a lot of information, but again, I think it's important that everybody knows what we know, so you have a sense of confidence around what's happening. Overall, as I look at where we are in the crisis, having been fighting it for 4 weeks, only 2 deaths, 29 people in the hospital, the system getting a bit more ready every day, I just have to say thank you to all the hard work that's happening, because we are in much, much better shape than many other cities and states around the country.
Governor, please state clearly whether this general shutdown applies to food sources, restaurants, grocery stores, coffee shops.
It does not. As I said, well, restaurants are already shut down. So restaurants, coffee shops, cafes, I was crystal clear about that yesterday. They are closed for all dine-in service until April 13th. So no bars, no restaurants, no cafes, coffee shops for dine-in. That is closed. You are still able to do takeout, and I have made it so that you can do beer and wine takeout with your food. Delivery is still allowed. Grocery stores will not be affected. Food stores will not be affected. They are still open. You are still allowed to leave your home. As I said earlier, you can leave your home to get essentials, gas, food, medical supplies, essential things. Leave your house, do what you need to do, limit your exposure, go home. So no, none of those food or food-related retail shops are affected by this order. Remember, I have imposed regulations around social distancing for grocery stores and big box retailers. They are limited in the number of people that they are allowed to have in the store at any one time. We have people at the front door with a clicker to count the number of people. And when if you're in the store and you're in line, if you're at the deli counter and you're very close to the next person, you're doing something wrong. Move away. If you're in line at the cashier and you're very close to the next person, please step away. So I hope that is clearer.
This next reporter is asking you to repeat some of your earlier remarks in detail about the quarantine orders for those who work in neighboring states like Massachusetts and Connecticut. Does this mean people who work in Massachusetts can't go to work?
No. What it means is, if you work in Massachusetts and you can work from home, you must work from home. So call your boss and ask if you can work from home. If you're allowed to work from home, you must work from home. There are many people who can't work from home. If you're a nurse, if you're a doctor, if you're a construction worker, many of the things, I know that's not possible. So what I'm saying to you is, you're allowed to go to Massachusetts to do your job. Go to Massachusetts, do your job, come home to Rhode Island, and stay in your house. The other day, Governor Baker said he wants everyone coming to Massachusetts from another state to self-quarantine. So I'm in touch with Governor Baker and Governor Lamont on a regular basis, and we're trying to the extent possible to coordinate our messages. Again, it's consistent to what Dr. Nicole Alexander Scott said. I need you to follow these directions, but also to use good judgment. The goal here is to keep everyone safe, for you to limit your contacts as much as possible. Absolutely, if you're sick in any way, you must stay at home. But also, I want you to keep earning a living if it's at all possible. I want as many businesses to be able to work as long as possible. So if you have to work in Massachusetts, do it. But when you come home at night, I need you to stay in your house. And if you need a hand getting groceries or living your life, then reach out to us. And we're going to be really, as we have more and more people in quarantine, we're really going to be ramping up our services to help you get you what you need while you're in your house.
Governor, the next question is, what happened with the tour of Rhode Island facilities by the Army Corps of Engineers? With other states building overflow hospital units, why isn't Rhode Island doing this aggressively now?
That is exactly what we are doing. We have a team of Army Corps of Engineers here on the ground with us. They've been here for about a week. They're working in close collaboration with the National Guard, and we have spent much of the last week surveying every possible place in Rhode Island that could be turned into a hospital. Yesterday, I personally was on a phone call with all of the hospital CEOs in Rhode Island, asking them to make sure that they have their surge plans in place, and we're working very collaboratively with them to figure out where the best places are in order for us to ramp up hospital capacity. I would like to thank all of the hospitals, and I mean all of them, from top to bottom, from the CEO to the custodians and CNAs and nurses and doctors and therapists and social workers. God bless every one of you. Thank you for your collaboration, and thank you for working so hard. I wish I could say this was going to get better. It's going to get worse before it gets better, so thank you for your strength. But for the people of Rhode Island, that's exactly what we're doing. We have a surge plan, and we're trying to work the plan. More hospital beds, thousands of hospital beds. We want to be able to provide thousands of additional hospital beds, staff those beds at the bedside, extra ventilators, extra PPE, extra medical equipment. That's exactly why I need your cooperation, because I cannot flip a switch and say 2,000 extra hospital beds. We need a few more weeks to get the system ready.
What happens if New Yorkers do not comply with the self-quarantine?
I made a decision yesterday that the quarantine for New Yorkers is not a suggestion, it's a direct order. It is punishable with penalties, in the first instance a fine, but also imprisonment. That is not our goal, that is not what we're trying to do, but I want to be crystal clear about this. If you're coming to Rhode Island from New York, you are ordered into quarantine. The reason for that is because more than half of the cases of coronavirus in America are in New York. And it is getting worse, not better. We are less than 200 miles and a few-hour drive from New York. So this is not meant to be discriminatory or unfair. It is a fact and consistent with our approach of being targeted and aggressive and fact-based. I felt that this was a necessary thing to do.
To continue that thought, New York City Police will be issuing fines to people disobeying social distancing rules. Will police in Rhode Island be doing that too? And if so, starting when and which police forces?
The answer is yes, and the answer is they already have. And it's all police forces. The Rhode Island State Police is out in force, as are local police departments, and it's just for all of our own safety. So that has already started to happen.
Next question is about our furry friends. Are pet stores for food essentials considered essential retailers?
Yes, they are.
That was easy enough.
He's usually not that brief.
And our last question for today's briefing, are the state police now going to be stopping all people with non-Rhode Island plates, even Massachusetts? What about people in East Providence or Seekonk who grocery shop right over the border?
That's an excellent question. The answer is no. So, as I said in my opening remarks, I have no perfect solutions here. Every decision I'm making is difficult and far from perfect. So the enforcement of this quarantine, as between people driving between Massachusetts and Rhode Island, is incredibly difficult, if not impossible, to enforce. So I'm asking the people of Rhode Island to obey and do the right thing and pitch in and do what's right for yourselves and your community. We will not be pulling over cars that have Massachusetts license plates, and we will not be stopping Rhode Island cars coming back into East Providence from Seekonk. We're doing that for New York only for the reasons I've already described. So what I will say to you is just do the right thing because it's the right thing to do. If you live in East Providence and you go to Seekonk for your groceries, fine, go. Go there, limited in time, go once a week, don't spend too much time, keep your social distance, not a problem. Come home, wash your hands, don't go if you're sick. But there will be no enforcement with license plates for people from other states other than New York.
Thank you very much, Governor.
Thank you. See you tomorrow.